guys, what's up? How's everyone doing? Welcome to Relax and Rollcovery. My name is Maria Pontillo. I am a doctor of physical therapy. So I created this class with the idea to promote recovery within our workouts and routines because we're seeing a high prevalence of injury, specifically exercise-related injury. So I treat a tremendous amount of patients with the foam roller. So I decided to incorporate it into a kind of yoga fusion. So the idea is to kind of just let your body relax, enjoy. We'll do a good 30 minutes, and then at the end, take a nice shavasana pose, and it'll be a good time. All right. Anybody have any injuries that I need to know about in advance? All right, let's do it. So first things first is you want to be warmed up before you do any foam rolling. So in the future, before you attend the class, try to hop on a bike, a treadmill or something, come a little early, get a good warm up in. I'm still going to warm you guys up, but just kind of to keep that in mind, particularly if you enjoy the class and something that you want to include weekly. So we'll start with some leg swings. So let's take the right leg out, and we're just going to swing across the body. And as you're doing it, you just want to open your hip. And this doesn't have to be a balance exercise. It just needs to be opening the hip, getting blood flow, keep the knee soft, using the roller just as a prop. Nice, and then we'll shift it to the side and just sort of swing it forward and back. Opening your hip flexors and your hamstrings. Nice, and then when you're ready, let's switch leg swings other way. So you probably will feel a brisk sweat coming on. Good, nice core tight, stay tall. Excellent, and then we'll swing it forward and back when you're ready. Same thing. Use the foam roller for support.
My face above the water. My feet can't touch the ground, and it feels like.
Excellent. Let's pick it up. Bring it back behind the head and forward. Okay, so it doesn't matter how many you're doing, just kind of feel it out. Open the chest. Exhale. And feel free to give feedback throughout the class. And I will come around and try to give you guys good tactile cueing as we go through. So if you're uncomfortable with that or don't want me to, let me know. About 4 more. 3. Good. 2. And 1. Let's do a squat. Yay. Toes forward, hips go back. Use that foam roller as a way to keep alignment so we don't fall forward. Again, at your own pace. Opening up the hips. So we're going to inhale and exhale at the bottom. Good. Let's do a few more. And last one. Cool. Bring the foam roller to the side of your mat and go ahead and step to the back of your mat. And do a little sun salutation to warm up. So take a big deep breath in. Exhale. Mountain pose. Palms forward, shoulders relaxed. Take a big deep breath again. Exhale, forward fold. Inhale, arching the back. Exhale, fold, nose to knee. And up, reverse swan dive, inhale. Exhale, down. Again, lift up. Exhale, fold. And arch, look forward, fold, nose to knee. And one hand at a time, let's walk it out into a plank pose. Getting alignment. You want those wrists, elbows, and shoulders stacked on top of each other. Slowly bend the elbows down, brushing the rib cage. Expand and open the heart. Lift, look up. Upward facing dog, toes down. Press the hips back. Lift the tailbone up. Relax the neck, relax the head, and run it out, heels down. Warming up the ankles and calves. Bring it up nice and high, both toes, tippy toe, lift, shift your hips back. Good, bring it back, walking your hands towards your feet, and swan dive up, inhale. Exhale, fold. Arch the back, inhale, look up, fold. Beautiful, walk it out nice, one vertebrae at a time, core engaged. And lower slowly. Vinyasa lift. Go ahead and shift. Look over your right shoulder. And left shoulder. Excellent. Back center. Up dog. Heels down. Run it out. Good, so warming up posterior chain, hamstring, calves, glutes. Up on the tippy toes. Shift those hips back. Bend your knees, hover over the mat. Drop all the way. Stack your wrists under your shoulders, roll the back up. Flatten down, look up. Good, so exhale. Let all the air out. Inhale, look up. Feel your own pace with this. A few more. Nice, guys. All right, shift your hips back, and we're gonna do dancing lions. You're gonna roll back into the hips. You can walk your hands a little more forward, and just sort of roll through the hips, weight bear on the hands, sort of gross total body. Warm up. Excellent. Switch directions. Really focusing on those rotators of the hips. So sink into it. Learn something about your body. So if you're feeling tightness in one area, know this is something to address when we hit the foam roller. Last one. Bring it back into down dog. Let's take one more flow. So go ahead and lift the right leg off the mat and open the hip out. Great. Bring the knee in towards your nose. Do it again. Press it up and back. Again. Exhale. Pull it up. Beautiful. And lower down. Switch legs. Open the hip. Great. Try not to weight bear too much into one hand. Even it out. Bring the knee in. Squeeze and press it back up. Nice. Let's do one more. Exhale. And back up. Great. Open the hips. Nice. And set it back down. Go ahead and walk those hands up towards your feet. And slowly roll it up one vertebrae at a time. And lift the shoulders. Inhale. Slight back bend. And let it go. Are you warmed up? Okay, grab the foam roller. We're gonna start with the anterior compartment, the quads. So you're gonna kneel behind the roller. And just kind of shift to the back of your mat. Going into a plank position onto your hands. We're gonna go on either the elbows or the hands. And you're just gonna begin rolling up and down the quad. So you really just wanna kind of feel out the first few rolls here and let it conform to the foam roller. So let your muscle give into it. Okay, the more tense we are, the harder it's gonna be. So So we want to accept tenderness, pain, and then address it. So if you feel one area a little more tight than another, that is your body talking to you. Keeping the core tight, trying not to sink at the back. So tendinitis will develop in areas where your muscle goes right at the bone. So right where it inserts at the bone or originates. So you probably will feel a little more tenderness right by the knee. So if you do, spend some extra time there. Do you feel it? Okay. Try turning your heels together. So now you're going more medial leg, like inside of your quad. Vastus medialis, VMO. And then you could do the same thing and point your toes in and hit lateral, vastus lateralis. So try to avoid still positions, okay? So we want to roll through the adhesions and break them up. Let's go a little quicker. Typically we want to do about 2 minutes. Okay, so really does take a good time on each one. So we're going to isolate the right leg and then kind of transition to the IT band. So go ahead and start shifting to your right elbow, your right forearm, and turn to your side. Prop your foot into the ground in front of your leg. Okay, and now you're just going to use that and push you forward and back, up and down the side of your leg, IT band. Okay, so runners, spinners, this should wake you up. Great, so let's switch it back to the center, and we'll go over to the left side. Feels good, right? Embrace the pain. So listen to your body. If it's telling you it's tender, you definitely want to take advantage. So I want to think of your muscle like filet mignon, right? We all want to be like filet mignons, right? Well, those little tender spots that you're feeling is more like beef jerky. Okay, so make it like a fillet. Woo! Great job. Back, both legs. Shift up. Sit your hips back. Now I'm past my knees. We're going to roll the shins. So we wear high heels all day long, right, Andre? So, runners, this is the tibialis anterior, your dorsiflexor of your ankle. Just as much as your calves get tight, so do the front of your legs. Great. About 10 more seconds and speed up. Great, guys. You can kind of like move the roller away from you and keep your hands still. And get a little ab workout while you're there. Woo! Nice. So really working all that fascial tissue, that kind of the superficial layer of the muscle, is the key to really breaking it up before we stretch it. So push it all the way back. Hover. Let that foam roller go to your side. Inhale, stand. Lift, expand. Exhale, fold. Walk it out one hand at a time. And take a slow chaturanga down, all the way to prone. Reach behind for your right foot. Pull your hips in, pull the tops of your feet. So, stretching all that anterior compartment. Try to relax your head. Inhale and exhale. Press into it. Lovely. Switch. Quad stretch. Press your hips in. Inhale. Exhale. Pull. Great. So it should feel a little bit better. Good. Release that. Shift the hips up. Coming to a kneeling position. You're going to inhale, lift. Now exhale, hands come behind your back, lift the chin. Expand and push your hips forward. Now, this is fine to stay here, or you could walk your hands, point your toes into the ground, to your heels, and open the chest. Squeeze your glutes. Decide where you're going to stay and commit to it. Good, 10 seconds more, breathe. One hand at a time, let it go. Good. And let's have a seat. Bring that foam roller behind you. Okay, so now we're gonna work the back. So, posterior chain, okay? So, go ahead and just lay flat back onto it. And you're gonna lift your hips up, support your neck, and you're just gonna roll up and down the spine. So this is probably gonna feel a little bit better than those quads. So let your spine conform over the foam roller. Okay, so try not to be tense. Each vertebrae can kind of round over as you roll, especially that thoracic spine where your shoulder blades are. A lot of shoulder pathologies and injuries happen strictly from limited mobility in the thoracic spine. So that's why as we age, we start to see that rounded posture. So we want to really open it up and promote extension in the thoracic spine, which is exactly what you're doing right now. Try to support your neck. And then we could shift to the lower back and then do like little isolations to the right. Quadratus lumborum to the left. Again, if you're feeling tenderness, address it. It's like fight through it, because the reward in the end will definitely outweigh the feeling you have right now. Breathe. Try not to hold your breath. Great, guys. About 10 more seconds. Can you go faster? Excellent. Back to a seated position. Gonna shift the foam roller behind you and sit on it. You're gonna do the butt. Cross, left leg over right, figure four. Put some weight on your hands, shift to the right, roll. So, piriformis glutes. Piriformis is a little tiny external rotator of your hips. If this baby gets tight, it will compress on the sciatic nerve and will cause sciatic pain down your leg. So if you experience those symptoms, Simply doing this every day can help. Do you feel it? It's a good hurt. Faster, go. It's actually quite difficult to massage. So even if you got a massage, like half the time the massage therapist really can't target this muscle. They don't really like to go to this area. So it's a good one to just kind of do on your own. Switch sides. So again, learn something about your body. One area may be a little bit more tender than another. So eventually this can just become maintenance and it will feel good. Excellent. About 10 more seconds. Go ahead, speed up. Go ahead, put weight on it. Shift on it. 5, 4, 3. Are you sweating? Good. Back center. Push it a little bit underneath your glutes and lift your hips and roll your hammies. Okay. Here's one that these are really deep muscles, thick, dense muscles. So maybe you're not even really feeling anything with rolling it. Trust that it's working, even if you're not feeling that same kind of tender pain that you were with the quads. And then you can go crossing one leg over and isolate one leg at a time. Take a rest from your wrists and your elbows if they start to get tender. Remember, we are basically holding our body weight up, so you definitely will feel core work. Turn your toes in. Medial hamstring. Adductors in the hip. Same thing, go to the other side, turn your toes out. So we don't just want to focus on just the belly only. Switch legs if you're doing one leg at a time. If you're not, stick with both legs or just kind of take a break. So this will save you a lot of money from having to go to your massage therapist. Hit the calves. You could sit down for this. Isn't that nice? And now you can push your weight forward. It's like you're rowing dough. You feel that? So they have a bunch of them that you could get. There's ones with ridges on it. But those are for like more, like I said, denser muscle. So the calves and hamstrings would be a good one for that. Good. Faster. Great. Release. Shift forward. And let's lay back one vertebrae at a time. Control your landing. So we're not just plowing down. Really focus on controlling each vertebrae. Chin up. Bend your left knee. Lift your right leg. Flex the foot. Lower it down. Reach behind your calf. Inhale. Exhale, pull. So you want to feel slight discomfort through the back of your leg. Now, if you can reach for the ankle or the outside of the leg, let the leg fall out. You could counterbalance the stretch by bringing your opposite arm out to the side like airplane wings. back center, and cross the leg over. So now we're going to hit that piriformis stretch. Go ahead, lift the hips up, lower down, pull it in, weave through the leg, feeling it through the outside glute, and rotate the ankle. Let's switch. Same thing. Other side, lift. Pull in. Chin stays up. Try not to bend the knees. Cross. And lift. Lower and pull. Rotate. Good. Release. Pull the knees in. We're going to rock it up. One more roll session, guys. So grab that foam roller. And we're going to lay on our side. We're going to do the lats. I know this is your favorite one. This feels wonderful. Okay, your lats. This big, huge muscle that runs all the way down your back to your shoulder. Totally neglected muscle that we never stretch or massage or roll out. So lay on your side. This is I'm going to come around and help you with this one. So it is the one of the harder ones. Leg in front, prop your hips up and begin to roll up and down that meaty part of the muscle. Yes. And this is not your hand isn't down, and I'm not rolling from there. So if you need more assistance, you prop yourself up and you roll from that. Okay, straighten this arm, weight bear on it, there we go, and lift your hips. You gotta get this arm up. Yep. That is. Go. There. Feel it? Right there. Feel it? Good. Feel it? 10 more seconds. Nice job. Go back to the center. Let's switch sides. Are you sweating yet? Last one. Let's go. Roll it out. The lats really contribute to a big portion of our human function. We use them for everything we do, basically. So, just as important as it is to roll out every other muscle, so is this. 10 more seconds, let's go. Come on. You can do it. 4, 3, 2, yeah. Okay, sit forward. Let's lift the arms up. Expand, lift the chin, side bend to your right. Don't let your left hip come up. You can bring it all the way down. Switch. Awesome. back up. Okay, turn forward and let's do one more time, laying all the way back to our mat. We're gonna do one still pose for finish. So inhale and exhale, lower slowly all the way down and relax. Going into a state of relaxation, letting your palms turn up to the sky. Let your toes hang out. Remember your intentions of why you're here today. Any areas that you tend to hold on to tension or stress, let it go. A few minutes of stillness and nothing. And I'll come around and give you some more essential oil. Rub your hands together. Enjoy the scent of eucalyptus.
Get a good feeling, yeah. Get a feeling that I never had before. No, I get a good feeling, yeah.
Inhale. Exhale. Inhale. Exhale. Good, let it go. Inhale. Exhale.
Everything that I see, I want your high love and emotion endlessly. I can't get over you. You left your mark on me. I want your high love and emotion endlessly. 'Cause you're a good boy and you know it. You act so different around me. 'Cause you're a good boy and you know it. I know exactly who you could be. Just hold on, we're going home. Just hold on, we're going home. It's hard to do these things alone.
One knee at a time, draw it in. Give yourself a big hug. Drop over to the right, open the arms, spinal twist. And switch directions. Go ahead and roll all the way to the same side and push it up to a seated position. Go slow. Take one big deep breath up. Hands to prayer, lower down, chin stays high. And as you leave today and approach the rest of your week, just remember, everyone's human. We all have weaknesses. We all have imperfections. But it's how we handle it that makes us a stronger person. Namaste. Thank you. Good job today.